Friends of the media, members of the public, the epidemic is now becoming a global pandemic. As for the number of confirmed cases, this morning is exceeded 590,000 cases. There's also been a spike in the number of deaths. And we've seen that in many countries, the healthcare system has been seriously overloaded. The situation is dire. As for Hong Kong, today we have a record high of 65 new confirmed cases. So the total number of confirmed cases now as high as 518. In a short space of 2 weeks, the number of confirmed cases has increased from 138 to 518 in Hong Kong. That's an increase of twofold. So we could see how serious the situation is. And then for this week, for the new cases, some 90% are imported cases. They are Hong Kong residents returning to Hong Kong from overseas. There are also Hong Kong residents who had travel history during their incubation period, or they are close contacts of these two clusters. As for some of the new confirmed cases, they involved, drinking at bars, attending wedding banquets and private parties. So this is what we call social contact. Now, in the face of the rapid developments in the epidemic, the SL government has always been taking swift actions. On the 23rd of March, Monday, I announced 4 aspects of measures. First of all, we'll limit non-Hong Kong residents coming into Hong Kong from overseas. We've tried to minimize the risk of imported cases. In a moment, the Secretary for Security, Mr. Johnny, will tell you about how effective this measure has been. But at the same time, we have to bear in mind there is still a large number of Hong Kong residents who will have to come back here. The second aspect of measure is about enhancing testing for people arriving in Hong Kong, also for people in the community, so that we could achieve early detection, early isolation and treatment. In a moment, I will invite Professor Sylvia Chan to tell you about these measures. The third aspect of our work is to take law enforcement action against those subject to quarantine orders. We've also taken strong measures to crack down on those breaching the orders. Here, I would like to thank the people of Hong Kong. They've been supporting our work and reporting cases of breach of the quarantine orders to us. In a moment, Mr. Johnny again will give you more details. The fourth aspect of our work is about minimizing social contact. On Monday, I announced that for all private clubs under the private recreational lease to close their sports facilities, children's play facilities, changing rooms, and so on. We are happy to note that for all 60-plus such private clubs, they have suspended those facilities. As for other private clubs not affected, not under the private recreational leases or recreational facilities at universities, they've also adopted the same measure. And also, I proposed, it was just a proposal, on Monday that we would amend the legislation to ban the sales and supply of alcohol at bars, restaurants, and private clubs temporarily. After the announcement of this proposal, there's been much discussion in the community. But I think that's a good thing, and that's exactly what we need in the community here, because we want to further reduce social contact. We need to fight the epidemic together. So what is the biggest challenge we face? I think after discussion, we've arrived at a consensus. The challenge we face is that we need to reduce contact between people. We need to reduce gatherings, meal gatherings, and so on. So during this period, I've met with the catering sector twice to listen to their views. The community believes that if we just ban the sales or supply of alcohol, it is not a targeted approach. We all appreciate what we need to deal with is the gathering of people, people having meals together and meeting each other. Now, we have a public health emergency at hand, so we need stronger measures, including enacting legislation to ban and prevent gatherings of large scales. It doesn't matter what occasions are and what industries are involved with respect to these gatherings. So the Executive Council called a special meeting this afternoon. We endorsed 2 new pieces of regulation under CAP 1599, the Prevention and Control of Disease Ordinance. One of the regulations is to ban a gathering of more than 4 people in public places. That is, prohibit group gatherings in public place. Anyone or any gathering that has more than 4 persons would be caught under this regulation, would be regarded as a group gathering, and it would be banned. The other regulation is about regulating catering service and the operation of certain premises. I will be giving you an explanation later. Now, these regulations are temporary measures in response to the public health emergency. The Secretary for Food and Health will give directives for a certain period, and during the period, these regulations will be valid. And each time a directive issue, it will not be for more than 14 days. But of course, after 14 days, if there is still a need to carry on with the measure, then another directive will be issued that will be valid for another 14 days. Now, I'm going to give you the details of the 2 regulations. First, the regulation is to ban group gathering. So, put simply, if there is a gathering of more than 4 persons, then such gatherings are banned. They are illegal. But of course, you could imagine in our day-to-day activities, we do have gatherings of more than 4 people often. So that's why there is a series of exemptions under the regulation for different types of group gatherings. There are about 12 types. I will give you the details later. Now, about cases where more than 4 people together would involve gathering at the workplace or for the purpose of performing a government function. For example, like today, there are more than 4 of us here, because here we are here to perform a government function. And also that covers the court proceedings, legislative council proceedings, district council proceedings. That is for these, for the legislature and other bodies, they could continue with the meetings. And weddings and funerals and will also be covered under exemption. By wedding here, I mean the ceremony itself and not banquet. Banquet will be covered under the other regulation on the catering service. So the regulation will come into effect at 00 hours on the 29th of March, Sunday. And as I mentioned, the validity period is for 14 days. Then the other regulation covers 2 parts. One part is on the catering services, that is all licensed restaurants, eateries, coffee shops, bars, and so on. They need to comply with 6 requirements. Firstly, the number of seats should not be more than 50% of the normal seating capacity in the premises. That means the premises can only be half full at most. And then there should be a distance of 1.5 meters at least between tables, or there should be other form of segregation. And then for each table, there cannot be more than 4 persons. That's the 3rd point. 4th point, both customers and staff must wear masks. And of course, when customers are eating or drinking, they can take off their masks. But after they finish eating, when they're just chatting, then they must put on the mask again. And the 5th requirement is that everyone must go through a temperature check as they enter the premises. And 6thly, the premises must provide a sanitizing hand rub for all people going to the premises. And the 2nd part of the regulation is about closure of 6 types of premises. So after the regulation takes effect, these premises will have to close. First, game center or amusement game centers in full. So there is a legal definition for amusement game center. 2nd type is a bathhouse. The 3rd type is a fitness center. The 4th type, place of amusement, and that includes billiard rooms, bowling alleys, skating rinks. And the 5th type is place of public entertainment. Here it includes cinemas. The sixth type, places for for hire for hosting parties, party rooms in general. So this regulation will this part of the regulation will take part earlier. That is at 6 p.m. tomorrow on the 28th of March. Again, the validity period is for 14 days. In the two regulations, there will be provisions on the law enforcement, inspections, enforcement powers, and so on. There are also penalties, involving fines and imprisonment. We will be giving all the details in a press release later on. And finally, I would like to say that on our regulation of these various trades, of course, these trades would be affected. It's going to add insult to injury to them. And then their employees will be affected too. The SAO government fully appreciates that, but then we are talking about public health and we are fighting an epidemic here, so we have to take this step at this point in time. But then I can promise that the SAO government will be giving financial assistance. The general direction is that during this period, we are asking employers not to dismiss their staff during this period. If they dismiss their staff now, then in future, if they apply for financial subsidies, their eligibility may be affected. And for such financial assistance is primarily designed to protect staff and employees. Now, in the middle of February, I announced the setting up of the anti-epidemic fund. There are 24 items under the fund. And in the past months or so, I see that the various trades and industry are being hit more. There are already certain trades which could benefit from the anti-epidemic fund, like the tourism sector. And of course, we know all around the world there is at least a red travel alert, so there won't be many visitors coming to Hong Kong. And that's why the tourism sector is further hit. Now, the sector has already benefited once under the anti-epidemic fund, but they are still struggling. And then there are other sectors not yet covered by the fund. Since we launched the fund, we've received reminders from many sectors that they've been left out. So I announced that the SAO government is going to launch a second round of anti-epidemic fund. We will deal with the two sectors I mentioned that face huge difficulties. Now, these sectors, whether they've been affected by our measures to enhance social distancing, well, we will deal with all of them. In the coming week, I will invite the relevant bureau directors to liaise with the trade to work out suitable measures, and then we'll have to go to the Finance Committee to ask for funding. Now, I'll invite Professor Sylvia Chen to tell you more about the testing of the disease.
Thank you, Chief Executive, and good evening, friends of the media. To protect the public health and our healthcare system, the government infection control work highlights. The Chief Executive had already elaborated 4 major measures, and these 4 measures, and especially on how to we prevent imported cases proliferating in the community, I would like to give you some new information. Of course, early identification of symptomatic cases is a key part of our infection control, especially at this stage. And all along, for those showing fever and those respiratory symptoms, or in the 14 days prior to onset with travel history, we will perform testing on them. In view of those of the imported cases and those travel history record a sharp spike. So the Center for the Health Protection, and since the 19th of March, has already stepped up the enhanced laboratory surveillance to provide all arrivals but asymptomatic travelers on testing for the COVID-19 virus, and enlarge the scope of testing for early identification of infected persons and reduce the risk of local transmission. And since the 25th of March, and for the UK and US and the other European returnees, we have offered testing service for them on a targeted basis. And yesterday, on 26th of March, and the Asia World Expo, we set up a temporary specimen taking center to accelerate sample collection. And it was always to facilitate those persons who had difficulty to send their friends and family members to send their specimen jar to contain points. And from the period into 26th of March, in the Hong Kong airport, we have distributed 5,613 contained jars to arrivals and received and finished testing 2,804 samples. And 26 of these samples have tested positive, made up 0.19% of all specimens. 0.9% of all tested samples, and for this illustrated that this virus testing is very important for early identification of cases, so that could able to get treatment early and would not lead to a community transmission. Here are the enhanced measures. First, we're proactively prepared to further enlarge the scope of the surveillance. And currently in the airport, and over the past 2 days that has just started, we will cover all asymptomatic arrivals. For these group of persons, will be given a specimen container at the airport. And like I said, at the Asia World Expo, we have set up a temporary testing center. Well, they have 2 ways to submit their containers. First, they could take the shuttle bus to the temporary specimen collection center and follow the instructions to collect the deep throat saliva samples. Upon completion, they can submit the specimen to the Department of Health staff and return to the residence as soon as possible to undergo the 14 days home quarantine. Or 2, they can collect their samples at home and through friends or families to return the container on the same morning to a designated collection point. And the second enhancement measures that we'll be looking into providing greater convenience for those arrivals submitting their samples. And earlier on, we have expanded collection points from 13 to 31 locations. And now we've been actively looking into other ways to collect the samples. And for example, on let's say collection, this is ongoing. And third, to collect more samples for early identification of patients, and while perfecting our collection mechanism, we will also study mandating all the arrivals to return their samples within a specified time. In fact, the early identification of cases not only help the patients to receive early treatment, but also minimize the risk of their families and the close contacts of catching the virus. As for the arrangements, if the test results come back positive, the CHP will contact these persons as soon as possible and arrange them to receive treatment at public hospitals. Generally speaking, and within 3 working days have yet to heard back from the Department of Health, that means that their samples are tested negative, and the persons will need to continue to complete their home quarantine until the end of 14 days. I would like to make a special appeal to all arrivals to proactively cooperate with the government specimen collection measures and to allow the Department of Health and CHP public health laboratories to perform virus testing on them as soon as possible and identify asymptomatic patients to reduce the risk of community transmission. And on hospital authority, and since the 20th of March, I would like to talk about the situation in Asia World Expo. Well, we'll see to expect that, and for some time in future, we'll deal with a large group of arrivals as well as to referrals for the Port Health Division to public hospital on suspected infected cases, and the HA have taking the instruction of the epidemic committee since the 20th of March, and World Expo and North Lantau we set up the testing centers. And those showing respiratory symptoms, we'll talk about those symptoms, that upon arrival, that we will perform testing on them. Looking at the figures, from 20th of March till yesterday, 26th of March at 9 o'clock evening, there are 411, 103 arrivals transferred to Asian World Expo and North Lantau Hospital testing centers for testing on the COVID-19 virus. As of now, there are 498 test results as negative and had already returned to their residence to continue with their 14 days home quarantine. And those tested preliminary positive, the Department of Health will conduct further testing, and upon confirmation, that we will announce them in due course. And finally, I would like to make another appeal. In order to protect the Hong Kong public and our healthcare system, I appeal to everyone that for those who are subject to the quarantine orders, they must exercise self-discipline, and we actually express the gratitude to a huge majority of those who exercise self-discipline. And second, I hope that these arrivals will proactively cooperate with the government on the specimen collection measures. And thirdly, just now the Chief Executive has said, this is very important, and hope that the public can exercise self-restraint and be patient and adopt all the social distancing measures and to minimize going out. So long we can work together and we not let up our guard, and we can fight this epidemic together.
Next, can I invite the Secretary for Security to speak? Thank you, Chief Executive. In March, the government implemented a series of measures to reduce the risk of imported cases. On the 19th of March, all arrivals from other countries must be subject to 14 days of mandatory quarantine. And then on the 25th of March, we started a measure that for people arriving at the Hong Kong International Airport by flight from other countries, and the people who have been to other overseas countries within the past 14 days, they have been denied entry to Hong Kong. And we've also suspended the transit service at the airport. Now, we have implemented this series of measures. So there's a significant drop in the number of arrivals, especially for non-Hong Kong resident visitors. On the 25th of March, that is the day one of the implementation of all these measures, non-Hong Kong resident visitor arrival at the airport dropped by 82%. Before the implementation of the measures, that is 928 people on the 24th of March, it dropped to 164 people. And then yesterday, the 26th of March, there's a further drop to 132 persons. That means there's a drop of 86% compared to the pre-measure days. As for the Hong Kong-Zhuhai Macau Bridge boundary control point, for the number of non-Hong Kong residents arriving in Hong Kong, again, there's a drop of 97% since the implementation of the measure. Before the measure, there were 989 people that dropped to 26 people. Yesterday, there were 31 people. For the Shenzhen Bay boundary crossing point, for the number of non-Hong Kong resident arrivals, it was 329 before the implementation measure, and it's dropped to 30. There's a drop of about 60%. and it was 138 on the 26th, and then yesterday was 124 arrivals. So for all the 3 control points, the total number of arrivals involving non-Hong Kong residents before the implementation of the measures, that is on the 24th of March, there were a total of 2,246 arrivals, and after the implementation measures dropped to 328 arrivals. That means a drop of 85%. Yesterday, the arrival number was 287. That's a drop of 87%. For the number of Hong Kong residents returning, before the implementation of the measures, there were 12,537, and then on the 25th, there were 4,969 arrivals, so a drop of about 60%. Yesterday, the number of arrivals was 4,117, a drop of 66%. So for the total number of arrivals, including both Hong Kong and non-Hong Kong residents, before the implementation of measures, it was 14,783. On the first day of the measure, it dropped to 3,297. Yesterday, it was 4,458. So on the whole, over 90% of the arrivals are Hong Kong residents. Next, on tracing people in breach of the quarantine orders, I'll give you some figures. Since the implementation of the new measures, that is starting from the 19th of March to the 26th of March, those in breach of the quarantine orders, the police found tracked down 77 of them. Of this 77, 40 were reported by the public, including passers-by or security guards of their residence, hotels. In some cases, it was the family members who reported these individuals. For these 77 people, they were sent to our quarantine centers. The police will be collecting evidence, and then they will pass this evidence to the Department of Health to consider whether to take up prosecution. The advice of the Department of Justice will be sought. Now, these people who breach the quarantine orders are most irresponsible. They will put others at risk. It is not right for them to do that. So we are grateful to the members of the public for reporting these individuals. Now, for people who breach the quarantine orders, as I said, the first thing we do is to send them to quarantine centers. And then secondly, after investigation, we will refer the cases to the Department of Health to consider prosecution. Because we want to keep up the achievements we have made in fighting the pandemic. We don't want such irresponsible individuals to derail our effort in fighting the epidemic. Thank you. Questions now? Please raise your hands. Please first identify yourself and then speak into the microphone, please. On the left over there, the one with spectacles. I'm from Hong Kong 01, Chief Executive